In normal times, this farming country north of Bangkok, Thailand, is prosperous, settled, and happy. But these are unsettling times. Normally, this nearby bird sanctuary welcomes all feathered friends. But these days, many palms have been beheaded to discourage open-billed storks from stopping by. Many storks are sick, and the disease they're carrying has broached the ultimate threat to human health, a pandemic.
We have the word epidemic, which means the outbreak of communicable disease or infectious disease over a population. The word pandemic is used when that outbreak extends over huge populations, generally across countries or even globally.
The world's worst pandemic hit just after World War I. A flu virus, once common only to birds, spread to humans. And when it was over, an estimated 30 to 40 million people were dead. That toll is what most people remember about the 1918 flu pandemic. But Scott Dowell, the doctor the American CDC sent to Thailand to run its bird flu operation, says we should remember this.
There were warnings before 1918 that the world at the time didn't have the technology or the capability to pick up on, but that we may be in a position in 2005 to pick up on these warnings.
When Em got sick, I thought it was just a normal case of the flu.
Like the alert sent out following the death of a 7-year-old Thai boy named M, whose normal flu kept getting worse until, after almost 3 weeks, he died in a hospital in Bangkok in March 2004. His mother suspects the cause.
Em played around with dead pigeons. It's possible he got the disease there.
Why M's twin brother Khan got sick but recovered while his brother died is still a mystery. But what is known is that what killed M and a neighbor was avian or bird flu, virus code H5N1, which had primarily been a disease of chickens. What those first cases verified was that the H5N1 avian flu virus could jump species from chickens to humans. And once it did, it could quickly prove fatal. But what was still unclear was whether the virus could be passed from human to human. That question was answered just 6 months later, when lab tests confirmed that first a child and then her aunt and then her mother all came down with bird flu, and only the aunt survived. The first response to these human deaths was kill all the chickens. At this farm, 60,000 chickens were killed in a week. The owner's son says the whole town has suffered.
No one has any eggs to sell.
The Thai government paid for the chickens, a fair price, says the farmer. But Thailand is the world's #4 chicken exporter and sells its birds all over the globe, putting a lot of people at risk. And domestically, within Thailand, there's a lot at stake, economically and emotionally.
I feel really sorry for the chickens.
We don't think of chickens as pets, but in Thailand that actually is the situation.
That actually turned out to be a clue in tracking the disease. A disproportionate number of victims, like M, were young boys.
These boys keep chickens as pets. They love their chickens, they hold them, they carry them around, and when they're sick, they pick them up, they try and nurse them back to health.
The good news is that medical detective work made that connection. The bad news is that killing all those chickens probably will not provide much protection. As it did in Hong Kong in 1997, where bird eradications stopped the H5N1 flu virus right in its tracks.
We now are past that in terms of the extent of spread or endemicity of H5N1 in poultry stocks.
Too many chickens in too many different areas and too many other species now with the disease in
Yes.
trend. Today, bird flu virus is common in Asian chickens and ducks, wild waterfowl, and what is worse, mammals like pigs and cats, and even
In a zoo, not too far from here in Thailand actually, it was passed from chicken to tiger, and now it seems from tiger to tiger as well.
So with the virus widespread in the environment, in the animal population, we're really sitting on a sort of potentially a ticking time bomb.
By being transmissible from cat to cat or tiger to tiger, you end up selecting those mutants of the virus that can bind to mammal cells better and be transmitted from mammalian cell to mammalian cell. You risk selecting for a virus that's going to have the property of efficient human-to-human transmission.
It takes an informed village and a nationwide system to hold the line against infectious disease, and Thailand has enrolled both in the battle against bird flu. All over Thailand, in villages like this one, and even in towns and big cities, a network of 850,000 volunteers is checking on public health among humans and among chickens.
We record how many chickens have been born each month.
How well this system works is a marvel to international infectious disease experts who are tracking the movement of H5N1 bird flu from chickens to humans.
Thailand has a very comprehensive medical and public health system, and so they have a very strong ability to monitor for diseases. I think that's very different than a lot of Thailand's neighbors.
That's why the Thai Ministry of Public Health and the American Centers for Disease Control have collaborated on 2 joint surveillance centers to pick up any evidence of avian flu as soon as it enters Thailand. One of those centers is near here, the Mekong River border between Thailand and Laos. The other is near the Thai border with Cambodia. Every visitor, every neighbor is likely to catch the attention of a Thai health volunteer like this one, ready with advice.
When a chicken dies, we teach them to put on gloves and how to destroy it.
And ready to report anybody who is sick before they have to go to the hospital. While at the local hospital in Nakhon Phanom, the Bird Flu Project has a monitor checking every admission for signs of pneumonia, often the first stage of deadly bird flu. And registering that patient is only the beginning.
Every patient gets a chest radiograph, which we digitize and send back to Bangkok to have a panel of radiologists review the images. So there's the clinical information, some demographic information, chest x-ray, and then pathogen information. So it's designed to be a pretty comprehensive surveillance system. The key would be to catch something early enough to prevent it spreading rapidly. Because if it becomes easily transmissible between people, it's going to spread very quickly. And if you don't catch it in the first couple of days, it's going to be too late.
Fear of a global pandemic has become a constant in modern medicine. But Scott Dowell says,
what has changed in the last year is that we have an actual virus that we can point to that is highly lethal for humans, can be transmitted from birds to humans, and has the potential for being spread in a very limited way amongst humans. We don't know for sure if this is the harbinger of a pandemic or that it's just going to fizzle out and be a bird virus. We're hoping for the latter, but we think it's prudent to prepare as if it were the former, as if this is our warning for the next pandemic.
Prudence is called for, the world's top infectious disease experts agree, because if this sickness spreads, no place will be safe.
That's what pandemic means. It's pan meaning everywhere. And I don't care what niche you may, what isolated island you may live on, or what comfortable place in a comfortable country. When this virus hits, it will spread very rapidly, and there'll be no way to seal the borders against a virus.
Dr. Aldous and Dr. Dowell doubt that H5N1 will become the pandemic bug. But they are convinced that there will be a next time, a different strain of avian flu. And because of everything that they're learning now, they say, the world will be that much better prepared when a pandemic comes. I'm Dave Marish for Nightline in Bangkok, Thailand.